Okay, my excellent friends. Now we do the heart. How about that? Okay. I kind of sort of started to remove some of these deals. Okay. Whatever looks like a blood vessel like this. Oh shoot. Excuse me. That's, you leave that in there, and then so I'm gonna start cutting off some of this gunk. Okay. This is part of the pericardium that kind of sort of surrounds the heart and protects and so forth and so forth and whatnot. Okay, my excellent friends. And then for the most part I'm doing this number here, so using my hands, because my hands will not cut anything. And you can see this connective tissue that covers, this is the aorta, you can see it. So the connective tissue here, sometimes if you continue to rip, I have to film this so that you can see how I'm doing. I almost ate that one up. I thought it was popcorn, it got like that. Well, no, I wasn't gonna eat it, of course. Kinda like myself. I cut mine because it was too long, guys. So don't be cutting some of these things. In fact, don't cut any of the blood vessels if you ask me first. Just in case. Because once you cut, you're done. That's it. It's not going back. So that my picture looks good. I could even throw that in the trash, actually. But do it later. At least if somebody's wearing gloves, they can just carry that to the trash and toss it. So that my brain doesn't look too gross. Okay, good. We cleaned up pretty good, didn't we? We're now wearing a tuxedo for the homecoming and stuff. You know how the homecoming and that was going on just now. I saw a lot of guys with tuxedos. Okay, there you go. We're in good shape right about now. So the first order of business is identifying the anterior side of the heart. So which side is facing your chest when it's in your heart? It's facing the sternum, okay? So the way you do that is that you look at the interventricular groove, or the interventricular septum sometimes it's called. I mean the interventricular sulcus, sorry. Sulcus is like those cracks, those lines and so forth. So it must be sloping from top right to bottom left. Okay? Like right now. Right now if I do this, it's kind of here and it's not really doing anything. So it must be sloping from top right to bottom left. Okay? Like this one right here. Okay, so in the side that includes the apex of the heart, that's the left side, and that's the bigger ventricle. The left side is the bigger ventricle because it pumps to the body. Okay, then the smaller one here, which is kind of on the top, that's the right ventricle. Okay, so if I put a pin on here and I'm asking what's the chamber of the heart, just like we say chamber of the brain, chamber of the heart, then you'd say right ventricle. You have to say right or left. Here I could stick it on the outside and say what's that chamber of the heart, you say left ventricle. And if I put a pin in this crack, in this line, you could say interventricular groove, and it's in your heart handout, all those things are labeled there, or interventricular sulcus. Okay, that's that. The way you will know this is the anterior side, so if this were in my heart, it would be like that in my chest. This will be facing forward, the anterior side. Okay, so you will see right on the front this major blood vessel here, which is the pulmonary trunk. This is going to that confirms that this is the anterior side. If you're looking here and you don't see the pulmonary trunk, you know that, boom, that's not the anterior side, okay? So this is the anterior side. And this you'll see the pulmonary trunk, which goes into the right side. It comes from there, you see? Use your dowels to show, you see? See how it is? When I put through the pulmonary trunk, Okay, it's going from the right side, pumping to the lungs. The pulmonary trunk splits into the left and right ventricles, left and right pulmonary arteries. Okay, left and right pulmonary arteries that are going to each of the lungs. Okay, so that's that. And then the aorta, this one goes to the boom. You see how it goes on the left side? Oh crap! I don't want to put a hole on my heart. You see what I'm saying? I told you that. I told you because it's kind of sharp. Normally we use wooden dowels. You see those sticky, those wooden sticks in it. Okay. So that shows that definitely this is the aorta, because the aorta comes from the left ventricle, pumps to the systemic circulation. Okay, you prove it to yourself. The pulmonary veins that bring oxygenated blood to the left side, okay, those ones usually get cut off, but maybe this is one of them. Okay, but usually those ones get cut off. You see, there's a big gaping hole here which goes to the, you see, it goes through there, and these are auricles. Auricles are sort of extensions of the atria, because the atria are not big chambers of the heart. So this will be the left auricle. If I put a pin here and I'm asking what's that structure, you say, okay, because it's on the left side, this is the left auricle and this is the right auricle, because it's on top of the right side. Because it gives more volume to the atria when they're filling up, because the atria themselves are very small chambers. You will see when I cut through the heart. So pulmonary trunk goes to the lungs, splits into the left and right pulmonary arteries. Okay, this is the aorta, and this is probably the aortic arc, so that it curves and goes down. Okay, the aorta supplies the systemic circulation, and this is the brachiocephalic trunk. Sometimes you see this branch of the aorta, sometimes you don't. It depends on your heart, and this may be cut off. So this is the brachiocephalic trunk, and this is the aorta. Okay, and then the superior and the inferior vena cava will be on the right side, right? Because the superior drains the head and the shoulders, and the inferior vena cava drains the lower parts of the body, deposited into the right atrium. Okay? So it will be somewhere close to the right auricle. Okay? And this is probably the superior vena cava right there. You know what I'm saying? Look where it's going. See, it's going to the right, into the right side. So this is probably the superior vena cava, and you may not probably see the inferior vena cava, okay? But we're just gonna call it vena cava, okay? You don't have to say superior or inferior, it doesn't matter. All you have to say vena cava. So we need 4 things, 4 major blood vessels, maybe 5, okay? Depending on what we have. Pulmonary trunk, it's an artery taking deoxygenated blood to the lungs. The aorta, coming from the ventricle, left ventricle, aorta carries oxygenated blood to the systemic circulation to the rest of the body. And the brachiocephalic trunk is a branch of the aorta which goes to the head and shoulders. Okay? The vena cava on the right side, okay, brings deoxygenated blood to the right atrium. And then over here on the left side, over the left auricle and stuff, you see there's 4 pulmonary veins that come with oxygenated blood from the lungs into the left side. So it goes into the left auricle. So if I put a pin here on the left, sort of near the left auricle, and I'm asking what's that major blood vessel, you say pulmonary vein. Okay? And then if I put a pin here, what's that major blood vessel? Pulmonary. You say aorta. Pulmonary trunk, okay, and then brachiocephalic trunk here, and then vena cava, okay, auricle, left auricle, right auricle, okay, left ventricle, right ventricle, okay. So you want to cut from the left side, you want to cut it in half, okay. Mine is not so distorted, so I'll probably be able to cut it nice and in half, okay. So you cut from here, from the left side, going to the right side, okay? Do not cut from the right side, please. Don't do that. Is it time up? I also lube my knife since I've got lube right there, okay? I lube it up like so. I lube it up and I lube up the other side so that it doesn't damage. It's not so critical with the heart, but you should do that. Okay, be careful, because this one, unfortunately, you have to hold it and cut towards yourself. Okay, so So I do that. Okay, my excellent friends. Okay, here I could just sort of cut over here like this and just finish it up like so. Okay, so the aorta, most of it is gonna go on this side. It doesn't matter. Okay, it's okay. And boom, I cut it. I open it like so. Okay, my excellent friends, is it time to go up? We got 2 minutes, right? We got 3 minutes. So I'm gonna go through these parts, okay, real quick. If you could stick around, that would be nice, you know. Okay. This is the left side, left ventricle with the apex. This is the right side. The right side is smaller, okay. And on the right side, you can confirm it to yourself because there is this. Sometimes it's thick and you can see it. Sometimes it's not on mine. It's very thin. This is called the moderator band. Okay, it moderates the, so that the right ventricle doesn't overfill too much, with too much blood. So that is the moderator band, and that confirms that indeed this is the right side. Okay, and also the small ventricle confirms it's the right side. So you don't have to be opening and closing it to know which is the right side, which is the left side. You can just see the one that contains the apex and it's bigger. So these are called cordae tendini. They hold these valves. Okay, so this valve, if I ask what's this major valve, you will say the bicuspid valve, mitral, because it's on the left side. If I ask here what valve is that, you say the tricuspid, because the tricuspid is on the right side. Okay, this is the aorta, right? Remember we said this is the aorta. So this here is the aortic semilunar valve. You see this valve right there? Aortic semilunar valve. All right. And then if I do this, and I take my scissors, and I cut through the pulmonary trunk, like that, I will be able to see inside the pulmonary semilunar valve. It's inside there. You can probably see it through the camera. Okay, pulmonary semilunar valve. But you just leave it like that. Okay. This is the interventricular septum, and the interatrial septum is kind of here. You can see the atria is very small. Okay. Inside of the ventricle, you see these major ridges. These are called trabecular cani. Okay, these. All right. So these major ridges are trabecular cani, and you see this sort of pimply little muscles of the myocardium that are attached to the cordae tendini. Then you would say the papillary muscles right here. Okay, and this is trabecular cani, and in the atria, those little ridges. I might put it down. You see right here. You see right here, like these ones. These are called pectinate muscles or musculi pectinati. Okay? These string-like structures are called cordae tendini, and sometimes I put a pin through this and I ask, what's that string-like structure? You say moderator band. Okay? Interventricular septum. All right? And this is the atria, okay, and then this is the mitral or bicuspid, and then tricuspid, and then this is the aortic semilunar valve. And that's it for the inside structures of the heart. Okay? All right? Thank you, guys. I think that's it, and those are the things that will come in the exam. All right? So I'm going to close it back up like that, and that's that. Thank you, guys.